A nosebleed is loss of blood from the tissue lining the nose. Bleeding most often occur in one nostril only. Nosebleed are very common. Most nosebleed occur because of minor irritation or colds. The nose contains many small blood vessels that bleed easily. Air moving through the nose can dry and irritate the membrane lining the inside of the nose. Crust can form that bleed when irritated. Nosebleed occurs more often in the winter when cold viruses are common and indoor air tends to be drier. Most nosebleed occur on the front of the nasal septum. This is this is the piece of the tissue that separate the two sides of the nose. This type of nosebleeds can be easy easy for trained professional to stop less commonly. Nosebleed may occur higher on the septum or deeper in the nose. Such nosebleeds may be harder to control, however, nosebleeds are rarely life-threatening. Nosebleed can be caused by 1. Irritation due to allergy, colds, sneezing, or sinus problem. 2. Very cold or dry air. 3. Blowing the nose very hard or picking the nose. 4. Injury to nose including a broken nose or an object stuck in the nose. 5. The backated septum. 6. Chemical irritants. Repeated nosebleeds may be a symptom of another disease such as high blood pressure, a bleeding disorder, or a tumor of the nose or sinuses. Blood thinners such as warfarin, clopidogrel, or aspirin may cause or worsen nosebleeds. To stop a nosebleed, sit down. 1. Sit down and gently squeeze the soft portion of the nose between your thumb and finger so that the nostrils are closed for a full 10 minutes. 3. Lean forward to avoid swallowing the blood and breath through your mouth. 3. Wait a 10 minutes before checking if the blood has stopped. It may to apply cold compresses or ice across the bridge of the nose. Do not pack the inside of the nose with gauze. Laying down with a nosebleed is not recommended. You should avoid sniffing or blowing your nose for several hours after a nosebleed. If bleeding persists, a nasal spray decongestant can can sometimes be used to close off small vessel and control bleeding.